Hello friends, let us now learn some important points about the nutrition. So in the nutrition, first we will learn about the enteral nutrition. Enteral nutrition is delivery of nutrients directly to the GIT. This enteral nutrition is actually preferred over the total parenteral nutrition, because this enteral nutrition is more physiological, and this will maintain the integrity of the GIT, and also this enteral nutrition will decrease the translocation of bacteria from the GIT, so that the bacteria which are present in the GIT will still be present happily, living happily in the GIT. It also reduces the inflammatory cytokines which are released from GIT. So we will have to enteral nutrition is a better way. Now this enteral nutrition can be given in 4 ways. One, you can give by oral supplementation, or we can give it by nasogastric tube, or we can also use nasojejunal tube. Actually this nasojejunal tube is better tolerated when compared to nasogastric tube. We can also use feeding gastrostomy can be done. This feeding gastrostomy is done in severe pancreatitis, or if there is any gastric outlet obstruction, we can do this feeding gastrostomy is done. And there is also feeding jejunostomy is also seen. Okay, so these are the routes of enteral nutrition. So first we will see some important points about the gastrostomy. Gastrostomy is you will directly put the tube into the stomach. In gastrostomy you are going to put the tube directly into the stomach. The methods of gastrostomy which are present are, we have Stam method, Witzel method and Janeway method for gastrostomy. But mainly the percutaneous insertion of this gastroscope under endoscopic guidance is preferred. That is called as PEG, which is percutaneous endoscopic gastrostomy. This can be done in 3 techniques. One, we have push technique, pull technique and introducer technique. We do not need to go into the details. So this is percutaneous endoscopic gastrostomy. Endoscopic gastrostomy. Fine. So this is about the gastrostomy. Then we also have feeding jejunostomy, where we put the tube directly into the jejunum. This feeding jejunostomy is actually preferred than the gastrostomy, because this feeding jejunostomy has decreased risk of aspiration, it is better tolerant, and it is good for severe pancreatitis, because in severe pancreatitis there can be remember, in severe pancreatitis there can be gastric outlet obstruction. So even if you put a feeding gastrostomy, the obstruction is at the outlet of outlet of the stomach. So as a result, actually in severe pancreatitis this gastrostomy is contraindicated. This is one thing which I have missed here. Yeah, in gastric outlet obstruction and in severe pancreatitis, this feeding gastrostomy is contraindicated, and we will prefer this feeding jejunostomy. Right. Now if you see the indications of these enteral nutrition, we can give enteral nutrition if there is protein energy malnutrition, any cases of dysphagia except for liquids, if there is major trauma or any history of surgery, inflammatory bowel disease, or if there is inflammatory bowel disease, or if there is low output fistula. In these cases this enteral nutrition is indicated. Enteral nutrition is contraindicated if there is small bowel obstruction or ileus, or if there is any severe diarrhea, or if there is any fistula which is involving the proximal small intestinal fistula, even then this is contraindicated. And this is also contraindicated in severe pancreatitis. In acute pancreatitis, the feeding jejunostomy and enteral nutrition is the treatment of choice, but for severe pancreatitis this is contraindicated. Now if you see the complications of enteral nutrition, one, we have tube related complications. In tube related complications there will be malposition of the tube or displacement of the tube is seen, and sometimes you will see blockade of tube or leakage of the tube can occur, or there can be erosion of the skin and mucosa can occur. Then we have GI complications which include diarrhea or constipation or abdominal pain, aspirations can occur. Then we have metabolic complications which include dyselectrolytemia, or we can have deficiency of vitamins, minerals and trace elements can be there. And we have some infective complications can also occur. There can be infections also. So this is about enteral nutrition. Thank you for watching.